Hello and welcome. Today we're diving into a specific type of glaucoma called silicone oil-induced glaucoma or SOG. This condition arises as a complication following the use of silicone oil in vitreoretinal surgery. Let's explore what causes this, how it develops, and what can be done about it. SOG, as the name suggests, is directly caused by the presence of silicone oil in the eye. Silicone oil is a clear, viscous liquid often used during vitreoretinal surgery to flatten the retina against the back of the eye, especially after retinal detachment repair, macular hole surgery, or in cases of proliferative vitreoretinopathy. While incredibly useful, its presence can unfortunately lead to increased intraocular pressure, ultimately resulting in glaucoma. The pathophysiology of SOG is multifactorial. The primary mechanism involves obstruction of the trabecular meshwork, the eye's natural drainage system. Silicone oil droplets, being heavier than the aqueous humor, can migrate and physically block this outflow pathway. This blockage leads to a buildup of pressure inside the eye. Furthermore, the silicone oil can cause inflammatory responses within the eye, contributing to trabecular meshwork dysfunction and increased resistance to aqueous outflow. Chemical toxicity caused by the silicone oil is also a possible cause of damage. The exact prevalence of SOG is difficult to pinpoint, as it varies depending on factors such as the duration of silicone oil tamponade, the specific type of silicone oil used, and the surgical techniques employed. However, studies suggest that a significant percentage of patients who undergo vitreoretinal surgery involving silicone oil implantation will develop elevated intraocular pressure, and a smaller subset of those will progress to glaucomatous optic nerve damage. It is more common in patients who have had silicone oil in place for extended periods. The signs and symptoms of SOG can be subtle initially and may be easily missed. Patients may experience blurry vision, halos around lights, or eye pain. However, many individuals may be asymptomatic in the early stages, highlighting the importance of regular eye exams following silicone oil implantation. As the condition progresses, patients may notice progressive vision loss, peripheral vision defects, and severe eye pain associated with significantly elevated intraocular pressure. Diagnosis of SOG involves a comprehensive eye examination. This includes measuring intraocular pressure using tonometry. Gonioscopy is crucial to visualize the angle between the iris and cornea, where the trabecular meshwork is located, to assess for obstruction by silicone oil. Evaluation of the optic nerve through ophthalmoscopy or optical coherence tomography (OCT) helps detect glaucomatous damage. Visual field testing is also performed to assess peripheral vision loss, which is characteristic of glaucoma. Slit lamp examination is useful to detect silicone oil emulsification. While SOG isn't typically classified into distinct types like other glaucomas, its severity can vary based on the degree of trabecular meshwork blockage, the level of intraocular pressure elevation, and the extent of optic nerve damage. Some cases may be mild and easily managed with medication, while others can be severe and require surgical intervention. Treatment and management of SOG focuses on lowering intraocular pressure to prevent further optic nerve damage. Initial management often involves topical glaucoma medications, such as prostaglandin analogs, beta blockers, or alpha-adrenergic agonists, to increase aqueous outflow or reduce aqueous production. However, these medications may not be sufficient in all cases. If medical management fails, surgical intervention becomes necessary. Removal of the silicone oil is the most definitive treatment and can often resolve the elevated pressure. In cases where silicone oil removal isn't feasible or doesn't completely control the pressure, glaucoma surgery, such as trabeculectomy or glaucoma drainage devices, may be required to create an alternative outflow pathway for aqueous humor. Prevention of SOG is crucial and begins with careful patient selection for silicone oil implantation. Employing meticulous surgical techniques to minimize silicone oil emulsification and migration is also important. Routine monitoring of intraocular pressure and optic nerve health following silicone oil implantation is essential for early detection and management of any pressure-related issues. Prompt management of any early elevation of pressure is important. The prognosis for patients with SOG depends on the severity of the condition, the duration of elevated intraocular pressure, and the promptness of treatment. Early detection and management can significantly improve the long-term visual outcome. Removing the silicone oil often leads to resolution of the glaucoma, but some patients may require ongoing management to maintain stable intraocular pressure. Recent research is focusing on developing biocompatible silicone oils that are less prone to emulsification and migration, as well as exploring new surgical techniques to minimize the risk of SOG. Furthermore, studies are investigating the potential role of anti-inflammatory agents in preventing trabecular meshwork damage caused by silicone oil. Thank you for watching.